everyone, my name's Ashlina and I'd like to share some information that many of you may not know. Not only is this little princess Audrey an internet sensation, she has found a way to use her newly found fame to bring awareness to something that I hold near and dear to my heart. As you see, Audrey and Hayden, my son, were both born with a rare disorder called Blackfan anemia, also known as DBA. As you can probably guess, this disorder affects people differently, as most disorders do. The thing is that many of you have probably heard about Down syndrome or maybe even autism. But not many people know about Blackfan anemia. I find this disorder particularly important because while Blackfan anemia doesn't define a person, it certainly is a piece of them. My son was recently diagnosed with Blackfan anemia, and I quickly found out that finding information about this disorder is just as rare as the disorder is itself. So along with Audrey, I would like to help bring awareness to this disorder. So what is Blackfan anemia? Blackfan anemia, again DBA, is a disorder of the bone marrow. So bone marrow, its major function is to produce new blood cells. In Blackfan anemia, the bone marrow malfunctions and fails to make enough red blood cells, which carries oxygen to the body's tissues. Most DBA patients are diagnosed within about the first year of a person's life, although this was not the case for my son, who was diagnosed at the age of 10. When Hayden was born, he was being followed by a genetics doctor who knew something wasn't quite right. She could not figure out what it was. She was unable for years, and she just kept trying and trying to put her finger on exactly what was going on with Hayden. But she knew something wasn't quite right. So after years of genetic testing, we were finally able to identify what was going on with Hayden. Now that we were able to put a name to everything, some things started to click and make some sense. Most kids with Blackfan anemia have physical deformities. Usually they're born with a cleft palate. And if you're not sure what that is, no worries. You'll see an example of what that looks like here in just a few minutes. But Hayden, however, was born with a hole in his heart and had to undergo multiple surgeries to correct this deformity. For children born without significant physical deformities, they usually present with unusually small head size, seen in this picture here, along with a low frontal hairline. Other facial features such as wide set eyes, seen here, droopy eyelids, and a broad, flat nose, seen in these pictures here. Small, low-set ears, and a small lower jaw. Affected individuals may also have an opening in the roof of their mouth. That's that cleft palate that we were talking about earlier. And that cleft palate can be with or without a split in the upper lip, also known as cleft lip. They may also present with a short, webbed neck, seen here, shoulder blades, which are smaller and higher set than usual, and abnormalities of their hands, most commonly malformed or absent thumbs, seen here. About 1/3 of the affected individuals have slow growth leading to short statures. It has yet to be discovered exactly what role DBA plays in a child's learning abilities. Hayden's educational struggles have been enormous. He is always trying my patience educationally, and the teachers as well. From the beginning, he had a hard time reaching milestones. Part of the delay was due to the surgeries he had and the things that he missed during recovery time from those surgeries. So he had a lot of catching up to do. The first year and a half of his life was spent undergoing surgery. So he had lots of that catching up to do. While he was playing catch up, he was just slipping further and further behind. He is now 11 and continues to fall behind educationally. One of the reasons I want to help bring more awareness to this disorder is so that we can learn more about DBA and how it affects people, not just medically, but as a whole. From a mother's standpoint, I need to know how my son is affected DBA, how DBA affects him educationally, maybe socially. Could this affect him socially? Or any of those other questions. We know some things about DBA, like potentially patients with DBA can live long and healthy lives with appropriate medical treatment. This medical treatment includes blood transfusion therapy and steroid medication, usually given through injection. The severity of Diamond-Blackfan anemia may vary, even within the same family. Not all individuals present in the same way I have just described, but usually patients with DBA have a few of these characteristics. If you look really hard, you may be able to see some of those in the picture above of Hayden. There have been some recent diagnoses where individuals with non-classical Diamond-Blackfan anemia have been identified. In addition, DBA can be genetically passed down from generation to generation. But in Hayden's case, his DBA was formed by a mutation. However, all of this stuff we do know, but we really need to know more. I want to get to a point where moms have a place to go to find answers to real life questions and not have to spend hours upon hours with no luck searching to find some shred of evidence that might help. With more awareness, we may be able to get to a point where families and, most importantly, in my opinion, educators know more about this rare disorder. Knowing more about this disorder, I can see how Hayden presents with some of the same features associated with Diamond-Blackfan anemia, though they are slight compared to others. But to the untrained eye, he just looks like you and I. My hope is that one day I will know more about Hayden's condition and will allow him to grow into the man I know he can be. Knowing now what you know, I'm hoping that many of you guys can join us in the quest to bring more awareness to Diamond-Blackfan anemia and eventually getting to a point where, again, mothers, medical doctors, and educators are more aware of what's going on. Thank you.